International Medical Corps arrived in Haiti yesterday, and we immediately went to one of the hardest hit areas called Les Cayes in the southwestern part of the island. We were able to fly into the area. Roads were impassable. Bridges were out. We saw incredible destruction below. Palm trees were down, lifted off of their roots. Farmland was destroyed. When we arrived in Les Cayes, you could see more clearly in detail what people had suffered. Homes without roofs, down trees, power lines, electricity without. About 80% of the buildings had been damaged. Many of them were destroyed. Right now, we have identified that the greatest needs are food, shelter, water, and health care. We went to one of the hospitals, Immaculate Conception, in Les Cayes, and they are already seeing cholera patients. They've had new cases of cholera, so we're extremely concerned about diseases, the outbreak of diseases. There's lack of clean water. At the hospital where we were, they didn't have enough antibiotics, analgesics. They didn't have cleaning supplies to be able to clean the wards. One man vomited in front of me, and we had nothing to be able to help clean him up. So we're really concerned that people are going to be threatened by diseases. Right now, International Medical Corps anticipates delivering health supplies, some medicines. We are going to be looking at water, sanitation, and hygiene. We're going to be looking at fighting cholera. We already have been working in the country since 2010 on combating cholera, but we anticipate that we're going to see a spike in cases, or there's a fear of that. So we want to be sure we are deploying enough resources to stem an outbreak. Cholera can be deadly. A person can die from cholera in literally hours a day. The body is depleted of necessary fluids, and it can be easy to treat if you have the proper treatment and hydration, oral rehydration salts or IV hydration. But if people are not getting the care they need, they can die from cholera. And while we are continuing to look at the mortality and how many people died in the hurricane, we don't want to lose more people from disease. People here don't have the kinds of support systems that we have in the United States. They are dealing with lack of access to health care, lack of food and water, and there aren't the air resources to be able to get supplies in. Today we are on an island called Ile Avache, and the island has 11,000 inhabitants. They are already completely out of clean water. The one clinic here is destroyed. Part of it is destroyed, and they don't have enough medicine and supplies. So when you're talking about the support system and the resources that are available, the Haitian people don't have nearly the kind of ability to deploy those resources in a disaster like a hurricane. In many cases, Haitians had to flee to more safe areas, relatives, schools, to churches. I met a family today, Michael and Marie, and their 6 children. They had to wait out the storm in a school. There are now 200 people staying in one room in the school. Part of the school was destroyed, and you have a lot of people staying in one room. All they have are the clothes on their backs. They don't have access to health care. One of their daughters has diarrhea and a cough and, needs to be treated. And you have 200 people packed into one area. This is a very dangerous situation. But the Haitian people are very resilient to these kinds of repeated weather shocks, earthquakes and storms. They've been through so much. They are starting to clean up. You're seeing people out and about beginning to clear away the palm trees and some of the rocks around their homes and rebuilding roofs. People are on top of their homes rebuilding. They're hanging their clothes out to dry. Today it's sunny for the first time. It's been cloudy and a little drizzly for the last couple days. People are trying to get back to business, but, this is going to take a long time. And Haiti already, it's the poorest country in the Western Hemisphere. So this is going to be a major rebuilding process.